Over 40 million Americans are enrolled in SNAP benefits, 75,000 here in South Dakota. That SNAP program provides low-income and other vulnerable individuals with access to discounted price, food, and drinks. But should soft drinks be removed from the list?
Grant Green has the arguments from the state capitol tonight, and he joins us live here at 6 o'clock. Good evening, Grant.
Good evening, Brian and Kara. Well, it was quite the tug of war between health groups who believe that SNAP should be a completely nutrition value program versus the private sector and executive branch who see this effort as a restriction of choice and a burden to implement. Sioux Falls Representative Taylor Rehfeldt, a nurse outside of session, described soft drinks in House Bill 1056 as, quote, non-alcoholic beverages that contain natural or artificial sweeteners.
The bill is not meant to be a philosophy, but it is a directive to make a nutrition program about nutrition. And every other nutrition program we administer, sugary drinks are excluded because they offer no nutritional value and are strongly associated with chronic disease.
Healthcare groups spent the day sounding the alarm on the potential detriments of these sugary drinks.
The proposed legislation is a vital public health measure to combat overconsumption of sugary drinks, which are associated with weight gain, cardiovascular disease, type 2 diabetes, dental decay, and a higher risk of future obesity in children.
If Rehfeldt's bill were to become law, it would require the state to submit a federal waiver request to exclude the drink options. Opponents, including the governor's office, claim that a federal solution is a better approach for a federal program, rather than paying hundreds of thousands of dollars and hiring 3 more full-time employees to enforce the legislation.
When we add administrative complexity to our program, we risk higher rates of error and increased costs to our state.
Risks of costly errors were not only presented by the executive branch, but the private sector as well.
So what our businesses need to know is, what are the items that are carved out specifically? We can't say, retailers, you can't sell soft drinks and SNAP, because you don't want to have a cashier make that judgment call at the time.
Ultimately, Rehfeldt made it very clear that the definition of soft drinks is based on what is excluded in other federal programs, such as the Women, Infants, and Children program, better known as WIC.
I've had members of this committee tell me that they've been lobbied by 10+ lobbyists. Big sugar is real in DC, just as it is in South Dakota. If Congress decides to prioritize these changes, we can simply adjust.
And Rehfeldt vented her frustration regarding the governor's office's opposition, saying she had tried to meet with them for a solution. The governor's office responded saying they have tried to set up a meeting as well, but nothing materialized. And the House Health and Human Services Committee supported the bill strongly, passing it on an 11-2 vote. One dissenting lawmaker still could not get over the restriction of choices, asking Rehfeldt to amend the bill so that juice didn't have to be all natural. Ultimately, Rehfeldt refused. Live in Pierre, Grant Green, Dakota News Now.
Grant, thank you.